Members of the Chicago mental health movement continue putting pressure on the city to keep 4 of its Southside mental health clinics open and to maintain adequate working staff there. Several staff, including psychiatrists, were laid off and the mental health facilities were threatened to close last April. But Mayor Richard M. Daley announced last April that $2.5 million of federal community service block grant funds would be allocated to keep the clinics open, and he instituted a mental health task force committee after City Hall officials met with some of the protesters. However, the mental health patients and the advocates remain skeptical that Daley will keep his word and the clinics will remain open. So on February 16, 2010, many of them packed First Mount Calvary Missionary Baptist Church, located in the Kenwood, Oakland community on the city's south side, for a town hall meeting with the newly appointed Chicago Department of Public Health Commissioner Becara Chakor on the human right to mental health services. Residents Journal has been following the battle since its inception more than a year ago. Here's more of what happened at the town hall meeting.
It's very important that these clinics stay open because all this violence, and I say it all the time to the mayor, all this violence we have out here. I'm the chair of the District Violence Community Coalition for CAPS, and I'm there with these parents who these kids have gotten killed. And all these kids have gotten killed and shot, and the violence that they got in these communities. It comes from these kids not getting help like I needed help when I was a kid. This is the reason why I was in the situation that I was in. And these kids really need help. And then you got parents that's raising kids, and they need these programs. They need their medication. So it's important that we look into this and make sure that we deal with the issues that we need to deal with to keep these clinics open and to deal with the mental health issues. Thank you.
To better the services for people, because if they don't, like at North River, there's just 2 workers. It's a tragedy. I know I'd be lost if it wasn't for my therapist. Nobody else wants to deal with me. Then there's nobody.
We want to see, I'm tired of having people talking to me about privatization. I hope the commissioners hear me. Privatization is not going to work. That is not what it's all about. We are not going to accept privatization because we know that. What happens when you privatize, there's nobody to go to. You just close down the city. When the money runs out, well, that's his problem. Right now, we're taxpayers and we're demanding that we have a chance to maintain these centers. And before this lady.
Private nonprofit mental health centers, for all of their virtues, are under no obligation to cover undocumented immigrants. They have no reason to try to serve underserved communities. And we see today, when we look at the map of Chicago, that very few of them are here around us, and many of them are in other places. Private nonprofit mental health centers, more importantly, are run by a logic, not their own logic, a different logic from a different place, and that logic is the logic of market-based insurance. So as long as private nonprofits are the basis of the mental health system, we'll have a mental health system that's particularized, that fails to have a universal vision, that refuses to provide mental health services to people who are undocumented, that doesn't seek to serve underserved communities, and that fails to be the services that the city of Chicago needs.
A couple of comments here. I think one, I want to reiterate what a lot of you have heard me say many, many times before. We have in our budget, we're committed to continue the 12 mental health, the services of the 12 mental health centers. You know, they're in our budget. Unless we get any serious cuts in our budget, we should be okay at those 12 mental health centers right now.
Well, I'm sure they might be closed in my center. And what's the answer to that?
Let's get questions from the side.
So I think I want to reiterate the fact that we are committed to the services that we have right now. Unless we get any cuts, we are committed to providing those services. The other piece is I want to reiterate the fact that meeting the challenges of our mental health system cannot be done by one party alone. It has to be done by the community in general. It has to be done by the city of Chicago. It's the consumers, the advocates, it's the participants, it's the private sector also. I mean, we can't do that alone. And again, I come from the private sector, and I've had a much better experience, obviously, in my job before. I've seen patients who are undocumented. I've seen patients who couldn't afford going anywhere else, and I've never had to turn anybody down. I mean, I had a much better experience in the private sector. But I think I do want to reiterate the fact that really meeting the mental health challenges of the city of Chicago cannot be done by one party alone. It really is a group effort. And you know, I want us to kind of work all together to be able to address those needs. And unless we do that, it's just not going to work. It really is not going to work.
Is that they're closing down centers. They're closing down parts of centers. And they're getting rid of staff. Are they going to bring these staff back? We need the staff back. Because they're also closing down the regular health part of the centers as well. They're losing staff. We need all of these people to run these communities. So I'm asking you, are they going to bring these staff members back, or at least some of these staff members back? Because there are a lot of consumers that go, but also there are a lot of consumers out here that don't go, that need to go. So they have to have a place to go.
Well, thank you for the question. I don't think we're closing centers. I think I want to make that very clear and repeat that again. I mean, we're not closing centers right now. We still fund it in our budget. We're not consolidating right now. It's still in our budget, the 12 centers. The question that you raised is very important about the staffing of these sites. And I heard the 2 staff centers. I've heard the sites without psychiatrists. One of the things that I've been working on and I've been going to be looking at very, very soon, and I think as soon as tomorrow, is really looking at what we call a hiring plan. I think it's confusing to me and to others is, you know, how many positions do we have per site? What type of positions do we have? Did these people retire and we never replace them? What's the story on each one of our sites? And that's what we're working on right now, to try to really look at the staffing in each one of our sites, to see, you know, how each one of those sites is budgeted to be staffed. And I can assure you that that's one of the things that I'm going to be working on very closely. If we're staffed to have, you know, each site to have 4, 5, 6 people, we want to make sure we're hiring these people and make sure that they're providing services.
These are our families in these communities. We're crying out now. But if any of them are lost, let that blood be on your hands. But we're standing here today to say we're united. And just as you came in, we can vote you out.
But it is our lives that you are playing with. And people who are seriously mentally ill have always recovered when they've been given the right support. And they've always failed when they haven't. And so the question, again, is simple. Whose side are you on? Thank you very much.
After the public hearing, Residents' Journal asked Commissioner Chakar what he intended to do with the information that he heard from the patients and their advocates. Here's what he had to say.
I think this is going to be part of what I'm going to be learning to, you know, how to do better services, and that's going to be great for me to kind of put a face to a lot of the stories that I've heard.